It's here, folks. After years of living in quarantine and learning how to deal with the daily existence of COVID-19, a not-so-new virus is now showing up. I'm talking about monkeypox. So are news headlines everywhere. So the real question is, even though everyone out there is exhausted, how worried should you all be? And if the US has been preparing for this since 9/11, why was our government's response so slow?
The World Health Organization declared monkeypox a public health emergency of international concern in July of 2022. The US saw the first recorded case back in May 2022. In August, the Biden administration appointed Robert Fenton as the White House's National Monkeypox Response Coordinator, and on August 4th, 2022, declared monkeypox a public health emergency after nearly 7,000 confirmed cases.
Real talk, anyone can get infected with this virus that is genetically similar to smallpox and develop that telltale painful rash. But some vulnerable communities are at higher risk than others. For example, over 98% of recorded cases right now are occurring in gay and bisexual communities, specifically in men who have sex with other men and their sexual networks.
And monkeypox can be spread in a multitude of ways. Anything from skin-to-skin contact in densely populated social gatherings like performance venues or concerts, to contaminated surfaces including towels, clothing, and bedding used by someone currently infected with the monkeypox virus. Additionally, in some rare cases, respiratory droplets like from coughing or sneezing can spread the virus. However, in those cases, face-to-face contact for a sustained amount of time, such as kissing, was the cause.
And when and if you contract monkeypox, it can actually be hard to tell if you truly are a carrier. There are PCR tests available, but surprise, surprise, they're in limited supply in the United States, and they require directly swabbing one of those painful lesions. Now, if you are exposed to monkeypox, it can take up to 3 weeks to develop symptoms. You could get flu-like condition like fever, fatigue, headache, swollen lymph nodes. But you really want to look out for that telltale rash, which can occur in some very sensitive places, like your face, feet, hands, inside your mouth, your genital, or your anus. And it comes in many different shapes and sizes. It doesn't just follow a textbook. It could appear as pimples, blisters, something in between. You could have one, or you could have many.
With cases on the rise, we are hearing a ton of questions as healthcare professionals. We are also hearing a lot of misconceptions about the virus. And Lord, we do not need any more misconceptions.
Myth number 1, monkeypox only infects gay or bisexual men who have sex with other men. No, full stop, we need to crush this myth. Because anyone out there can catch monkeypox. And it's not appropriate to stigmatize anyone about anything, especially when it comes to healthcare. Yes, gay and bisexual communities are being disproportionately affected. However, anyone can catch monkeypox. Now, stigmatization can lead to discrimination for those who are infected, create a false sense of security for other communities, or it might prevent someone from seeking treatment because they may feel embarrassed or fear being called a scapegoat. In order to appropriately combat this virus, we need to spread awareness that anyone is at risk and not simply label it as an STD, STI, or a virus that only infects the gay community. Anyone and everyone should feel comfortable about speaking up about monkeypox and asking questions while we maintain that there is a group who is at higher risk and they deserve awareness and equitable treatment.
Myth number 2. You can't get monkeypox if you've already had chickenpox. Interesting theory, but no. Although both viruses can cause skin rashes, chickenpox and monkeypox are two very different viruses. Monkeypox is an orthopox virus, and chickenpox is a form of the herpes virus. Yes, both viruses can be shared through skin-to-skin contact or sustained face-to-face contact, but chickenpox spreads more easily than monkeypox.
Myth number 3, monkeypox is caused by the COVID-19 vaccine. Are you being serious?
There's no connection between the COVID vaccine and monkeypox. I mean, the two viruses are not interrelated. They have nothing to do with each other. They didn't originate in the same places. They don't share very many characteristics with each other. So It's just important for people to remember this is a virus that's been circulating for a very long time. We have to be humble about what we know and what we don't know, and to really shore up these knowledge gaps so that we can refine our approach and really be able to get in front of this virus.
Epidemiologist Anne Rimoin, one of the world's leading experts on monkeypox, someone who has studied the virus for decades, is going to set the stage on why this virus is causing so many issues.
Monkeypox is an orthopox virus, and it belongs to the same family as smallpox. This virus, monkeypox, was discovered in 1958 in monkeys in Denmark, in a colony of monkeys, and that's why it's called monkeypox. But it's actually really a rodent pox. It was first documented in humans in 1970 at the end of the smallpox eradication program, when they were investigating every case of rash illness. First case that was documented, although this was certainly circulating in DRC prior to that, was in a 9-month-old child who was not vaccinated, and it was from exposure likely to an animal reservoir. That's how we really understood that monkeypox was a virus that could circulate in humans. The big concern is that it's going to become established in human populations and potentially could then spill into animal populations, in particular rodent populations. And if that happens, then we're very concerned about seeing this become endemic in the US and elsewhere where it hasn't been previously.
So right now, there are thousands of cases of monkeypox in the United States, but this didn't have to be reality. We could have limited the spread. So Anne, can you walk us through what some of the flaws were in the US government response and how this could have been different if we followed a better protocol?
Well, I think that declaring it an emergency earlier definitely would help. It definitely underscores the importance of this, draws a very strong line under it, and lets people understand that this is serious, this is really important. It's also, making sure if we had been really aware of the number of vaccine doses that were available and had them on hand earlier, that would definitely improve things. And also, being able to ramp up testing more quickly would have been great.
On the topic of vaccines, let's talk about the vaccine that is thought to prevent the spread of monkeypox. According to the CDC, past data suggests that the monkeypox vaccine is 85% effective, but there's no conclusive data on this current outbreak. There's also some problems in terms of access and supply. People are waiting for hours trying to get their monkeypox shot.
The 2 vaccines currently being shared with the public and found in the Strategic National Stockpile, Jynneos, a vaccine that requires 2 shots given 28 days apart, and ACAM 2000. Both are recommended for anyone over the age of 18 and at risk for infection. According to the CDC, those that are vulnerable include people who are aware that one of their sexual partners in the past 2 weeks has been diagnosed with monkeypox, people who had multiple sexual partners in the past 2 weeks in an area with known monkeypox cases, as well as children under the age of 8, and if you are pregnant or immunocompromised.
Starting in the early 2000s and after 9/11, millions of doses were stored in the Strategic National Stockpile to be prepared in the event of a bioterrorism attack. But in 2017, about 27 million doses of Jynneos were expired, had to be tossed out, and the national supply was basically depleted. There were still doses of the older vaccine, ACAM 2000, left, which has more severe side effects. Basically, you have to prick your skin and allow a lesion to form. But then 300,000 more doses of Jynneos were ordered to replenish the supply, but because of delays in shipping, only 2,400 doses were available in May 2022.
Here we are in a situation where we have a very beleaguered health system. We're still dealing with the COVID-19 pandemic. We've not yet invested in health systems, in human capital, in the infrastructure that's needed to be able to get in front of these viruses, detect them early, and be able to rapidly respond.
I have a question about vaccine supply, and I'm curious if you have any thoughts or concerns about the switch from a subcutaneous monkeypox shot to an intradermal one. By doing this and essentially having 5 times the amount of supply sounds awesome, but people have questions. What more can you tell us?
The idea of an intradermal vaccine is a good one. That's traditionally how smallpox vaccines were given, and it should, in principle, provide a more robust response. But something that we need to study in the real world. But we really don't have good data on how effective this vaccine is going to be at preventing spread of the virus through various modes of transmission. So, for example, the mode of sexual transmission might be, the vaccines might not work as well as they do against more casual contact or respiratory contact or contact with virus from contaminated objects. So, there's a lot of work to be done, but I think it's really important for us, we don't have a lot of vaccine. We have a lot of people at risk. So let's get that vaccine out there. Let's protect people as much as we can and study how, if there are ways we need to refine it going forward.
There's also an investigational antiviral, Teapox, or tecovirimat, that can be prescribed to you by a doctor once you have a confirmed infection by monkeypox. And it can shorten the duration of symptoms, such as those painful, excruciating lesions.
Unfortunately, the FDA has only approved the antiviral to treat smallpox, not monkeypox. Human trials are set to begin in the fall of 2022. However, Teapox can be prescribed as the CDC has lifted some barriers through expanded access. Now, what is expanded access? It provides access to a non-FDA approved drug to treat certain illnesses, and it involves a lengthy application and waiting to receive your dose. And considering the painful lesions that form on the skin with monkeypox, this can be an excruciating, never-ending wait.
Further testing is still needed on the efficacy of Teapox, but early data is promising, according to SIGA, the manufacturer of the drug. If you're symptomatic and have tested positive for monkeypox, reach out to your healthcare provider ASAP to discuss access, because the process can be kind of lengthy. Sheena, Bartok, how are you feeling about the headlines about monkeypox, the reality of potentially another epidemic, the growing numbers? Lay it on me. How are you feeling?
It's hard. A part of me is like, we got this. We've been going through this already. And as healthcare workers, we've been dealing with contagious diseases for a very long time. Monkeypox isn't new, nor was COVID, as far as us dealing with infectious diseases that we can take home to our families. But this one is a little different. I think that skin to skin things, it changes how people want to interact with this disease. So it makes me feel overwhelmed for the patients and how they're going to be received, but also for the nurses and the burnout and the fear and just another pandemic.
I think about with COVID-19, when someone was sick and then all of a sudden they couldn't work, they couldn't interact with friends, family, provide for families, be on the front line. With monkeypox, you could potentially be isolating for up to a month. And that's not sustainable at all. And so I see this adding to burnout in the sense where people are once again not wanting to get sick. People are taken out of society, but also our healthcare system, our society cannot sustain another rampant infectious disease.
Yeah, and it's up to us. That's why everyone's watching PBS Vitals, because we're educating and we're trying to communicate with people in a way that they understand. It's so important that we don't take information just from the internet or just from Google, that we're actually talking to healthcare professionals, but actually talking to our doctors and communicating. When doctors ask you those questions of how many partners have you had and all those things, we're asking for a reason, because there are diseases out there like the monkeypox. So I think that we really just have to take it, be really smart about educating people.
And let me just add one more thing. For anyone out there who's watching who was like, we are tired of infectious disease, we want no more of these, I'm like, yeah, buckle up. Because with climate change, with human mobility, with public health, inequality, with deforestation, with all of it, we unfortunately are probably going to see more and more outbreaks. So it all honestly just comes down to us preventing them, being more prepared, and being more aware as a society.
If you have any other questions, or if you want to leave us a comment, hit us up on our socials. We want to hear from you.
Also, if you haven't already, make sure you subscribe and hit that like button. See you next time on PBS Vitals.